Amoxapine is a tricyclic antidepressant used in the treatment of neurotic or reactive depressive disorders and endogenous or psychotic depression. In this video, let's found. What is Amoxapine? What is Amoxapine used for? Contraindication. What are the side effects of taking Amoxapine? How does Amoxapine work? How to use Amoxapine? What is Amoxapine? Amoxapine, sold under the brand name Asendin among others, is a tricyclic antidepressant. It is the N-demethylated metabolite of loxapine. Amoxapine first received marketing approval in the United States in 1980, approximately 10 to 20 years after most of the other TCAs were introduced in the United States. What is Amoxapine used for? For the relief of symptoms of depression in patients with neurotic or reactive depressive disorders as well as endogenous and psychotic depressions. May also be used to treat depression accompanied by anxiety or agitation. Contraindication. Its use is also recommended against in the following disease states: severe cardiovascular disorders, potential of cardiotoxic adverse effects such as QT interval prolongation, uncorrected narrow-angle glaucoma, acute recovery post-myocardial infarction. Its use is also advised against in individuals concurrently on monoamine oxidase inhibitors or if they have been on one in the past 14 days, and in individuals on drugs that are known to prolong the QT interval, e.g. ondansetron, citalopram, pimozide, sertindole, ziprasidone, haloperidol, chlorpromazine, thioridazine, etc. Side effects. Very common, greater than 10% incidence, adverse effects include constipation, dry mouth, sedation. Common, 1 to 10% incidence, adverse effects include anxiety, ataxia, delusion, confusion, dizziness, headache, fatigue, nausea, nervousness/restlessness, excessive appetite, rash, increased perspiration, sweating, tremor, palpitation, nightmares, excitement, weakness, ECG changes, edema, an abnormal accumulation of fluids in the tissues of the body leading to swelling. Prolactin levels increased. Prolactin is a hormone that regulates the generation of milk. Prolactin elevation is not as significant as with risperidone or haloperidol. Pharmacodynamic. Amoxapine is a tricyclic antidepressant of the dibenzoxazepine class, chemically distinct from the dibenzodiazepines, dibenzocycloheptines, and dibenzoxapines. It has a mild sedative component to its action. The mechanism of its clinical action in man is not well understood. In animals, amoxapine reduced the uptake of norepinephrine and serotonin and blocked the response of dopamine receptors to dopamine. Amoxapine is not a monoamine oxidase inhibitor. Clinical studies have demonstrated that amoxapine has a more rapid onset of action than either amitriptyline or imipramine. Mechanism of action. Amoxapine acts by decreasing the reuptake of norepinephrine and serotonin, 5-HT. Half-life: 8 hours. Dose: depression. Initiate at low dose, 25 mg Q8-12HR, and gradually titrate upward every 5 to 7 days up to 200 to 300 mg PO/QHS. If dose exceeds 300 mg per day, administer in divided doses, Q12HR. Outpatient, not to exceed 400 mg per day. Inpatient, may require higher doses, up to 600 mg per day, divided Q12HR. Safety advice. Amoxapine should be used only when prescribed during pregnancy. Infants born to mothers who have taken similar medications during pregnancy may have problems such as very deep sleep, trouble urinating, shaking, tremors, and seizures. That's all the information about Amoxapine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.